Welcome to The Explainer. Today, we're taking a hard look at a healthcare system that feels like it's in critical condition. We're going to uncover a terrifying threat that's quietly turning our hospitals into danger zones. And we'll meet one doctor who's on a mission to fix the whole thing with artificial intelligence.
So, here's how we're going to break it down. First, we'll diagnose what's making our healthcare system so sick to begin with. Then we'll look at the massive threat of superbugs. We'll meet the doctor who's fighting back and check out his AI solution. Then we gotta ask, why did the system push back so hard? And finally, we'll imagine what a whole new future for our health could look like.
All right, let's start with a really fundamental and honestly kind of uncomfortable problem. We have a system where a patient's health can sometimes take a backseat to financial targets.
I mean, listen to that. Every day. That's a shocking admission from someone who worked inside a hospital. It just lays bare this core conflict where doctors are actually being pressured to think more like salespeople than caregivers. You know, this isn't just a small crack in the system. It suggests the whole foundation is warped.
And this table, well, it shows you the cold, hard math behind it all. Hospitals are literally tracking doctors based on something called surgery conversion rates. Yeah, it's a business term. It means how many consultations a doctor can turn into a profitable procedure. So look at Doctor 1. They give the right consultation, but only 8% of their patients get surgery, so they get fired for low profits. Meanwhile, Doctor 3, with a 20% rate, they're a top performer. The whole thing basically encourages unnecessary procedures and punishes good medicine.
And here's what that leads to: a total breakdown of trust. When a senior employee at a hospital admits they wouldn't even bring their own family there for care, what does that tell you? You know the profit-first model has created a system that is failing at its most basic job.
Now, this profit-driven system has consequences that go way beyond just your wallet. There's a much deadlier, much quieter crisis growing inside the walls of our hospitals, turning these places of healing into dangerous hotspots for infection.
Okay, so what exactly is a superbug? The most important thing to get is that our miracle drugs, antibiotics, are starting to fail. We're actually entering what a lot of experts are calling the post-antibiotic era, an era where a simple infection could become deadly again. And no, this isn't some sci-fi movie plot. It's a very real and honestly a very scary future. And this term, gray rhino, just perfectly captures our inaction. See, the superbug pandemic isn't some surprise black swan event that nobody could have seen coming. Nope, it's a gray rhino, a massive, obvious danger that is charging right at us while we kind of just stand there and watch.
So yeah, why aren't we moving? This isn't some far-off threat. It's here, right now. Studies are finding superbugs colonizing everything in hospitals: the equipment, the bed sheets, even the hands of the healthcare workers who are supposed to be helping us.
Just think about this number for a second, 90%. A study found there's a 90% chance that if you touch an infected call button in a hospital, you also get infected. It just shows how incredibly easily these things spread in the one place you're supposed to go to get well.
Okay, so in the middle of this systemic failure and this growing biological threat, one doctor's own personal journey ended up forging a completely new, revolutionary path forward.
This is the story of Dr. Kadiali Srivastava, and it feels like his entire life was preparing him for this moment. From watching ancient debates about logic as a kid, to seeing his friends die from simple infections, to even having to diagnose himself when the system failed him, every single one of these experiences shaped his totally unique approach to medicine.
And this quote right here, it gets to the very heart of his philosophy. In a world of expensive tests and appointments that last 5 minutes, his idea is almost radical. Just listen to the patient. He believes the real diagnosis is hiding in the story of the illness, the way the patient actually lived it.
So how do you take that really personal, story-based approach and scale it up to help millions of people, especially when just visiting a doctor's office is becoming more and more risky? Well, Dr. Srivastava turned to AI.
Dr. Srivastava saw that the symptom checkers we have now are just fundamentally flawed. They're like a first-year med student, you know? They look at one symptom at a time with really simplistic logic. His app, Dr. Maya, is completely different. It's designed to think like a seasoned expert, analyzing the entire pattern of symptoms, and it's built on 40 years of actual clinical experience.
So what's the secret sauce? It's something he calls symptom triads. Instead of just looking at a fever by itself, the app looks for a combination like fever plus chills plus an enlarged spleen to flag malaria.
It's this pattern recognition, this focus on specific combinations that lets the app identify really serious diseases with incredible accuracy. This isn't just about big data, it's clinical wisdom turned into an algorithm.
But you know how it goes. When you try to fix a broken system, especially a system built on making money, well, the system tends to fight back.
From the very beginning, his own colleagues were the ones resisting his ideas. They didn't see a tool that empowers patients as progress. They saw it as a direct threat to their business model, a threat to their income. And the resistance wasn't just from his peers. We're talking powerful gatekeepers, from big tech platforms to international health organizations. They initially ignored him, or even worse, blocked his work. And this was all happening while the threat of superbugs was making a tool like his more necessary than ever.
But despite all that resistance, this new approach points toward a future that's not just healthier, but frankly, a whole lot safer for every single one of us.
Now let's be really clear here. This is not about replacing doctors at all. It's about building a smarter, safer system. For us, the patients, it's like a first line of defense, a tool to help us avoid a potentially dangerous trip to the hospital, unless it's absolutely necessary. For doctors, it's a powerful filter, freeing them up to focus their time and skill on the most critical cases. And for all of us, for public health, it's an early warning system that could help us spot the next pandemic before it explodes.
When you get right down to it, Dr. Srivatsa's work proves that we have the tools right now to build a more accurate, more accessible, and more humane healthcare system, a system that can actually protect us in this coming post-antibiotic age. The technology is here, it's ready to listen. The only real question left is, are we?